Hello, my name is Charlena Bagwell. I'm a FNP student at AState. I did an analysis of gestational diabetes screening rates within a local women's clinic setting. This is my poster for my presentation. This is all of the research I've done at the local clinic for gestational diabetes for the screening rates. It talks about the introduction and purpose, the objectives, the methods, the population, the findings, the discussion and action plans, and my references. And I'll talk about all of those individually. Today, gestational diabetes is more common. It has great effect on both mother and the baby throughout the pregnancy. According to an Arkansas PRAMS report in 2012, 10% of women who had a live birth in Arkansas had gestational diabetes. Screening is required within pregnancy between 24 to 28 weeks gestation to diagnose to be able to receive treatment if needed. Gestational diabetes is diabetes that develops during a pregnancy and affects how the cells use sugar. To diagnose the gestational diabetes, an initial glucose challenge test is completed. This is called the 1-hour glucose test. If the blood sugar test is elevated on that glucose challenge, a follow-up glucose tolerance test will be performed. This one's called the 3-hour glucose test. The blood sugars will be checked every hour for 3 hours. If at least 2 of those glucose readings are higher than normal, they're diagnosed with gestational diabetes. With an early diagnosis and treatment of gestational diabetes, complications are reduced that could happen to both the mother and the baby during the pregnancy and delivery. Gestational diabetes can lead to macrosomia, which is a large infant at delivery, preeclampsia, preterm labor, hypoglycemia in the infant, and even delivery of a stillborn. Treatment for gestational diabetes could include diet and lifestyle changes. Oral medication and insulin can help control the gestational diabetes to prevent complications from arising during the pregnancy. The purpose of my study is to raise awareness to the importance of gestational diabetes screening at the appropriate time to receive the needed treatment for a healthy pregnancy and delivery. The objective of my study is to see what percentage of pregnant women are being screened for gestational diabetes within the correct time frame during their pregnancy at a rural Arkansas women's health clinic. This is a picture from the World Diabetes Foundation. It gives details on what gestational diabetes is, how many women it can affect, who is at risk, and what complications that could arise from the diagnosis. For my research, I did a descriptive study that was conducted at a Royal Arkansas clinic through a retrospective chart review of 50 electronic medical records. Simple mathematical calculations were utilized to determine the percentage of patients who were screened at the appropriate time frame in their pregnancy for gestational diabetes. For this study, charts reviewed included pregnant female patients between the ages of 16 to 45 years between the dates of February 2019 and February 2020. This is another picture that goes into detail about the risk factors for gestational diabetes and also the complications that can arise from gestational diabetes. During my research, I found that the women's clinic screened 44 out of 50 of the women, which is 88%, within the appropriate time frame in their pregnancy for gestational diabetes. 4 of these 44 women were screened early due to risk factors in the pregnancy as well within the appropriate time frame. I found that the women's clinic had 6 out of the 50 women that were not screened at the appropriate time frame. This was 12%. 3 of these women did not get screened within the appropriate time frame due to not getting prenatal care. One of these patients had her screening completed at 30 weeks because she did not show up for her scheduled appointment at 28 weeks. And 2 of the women were not screened during the appropriate time frame due to transferring care after the 28-week gestational mark. When considering recommendations to screen all pregnant women between the 24 to 28-week gestational mark for gestational diabetes, the Royal Women's Clinic that I did my research at was found to be efficient in screening women within the recommended time frame. Out of the 50 women in this study, 5 women were actually diagnosed with gestational diabetes and were able to get the recommended treatment throughout the pregnancy and delivery to reduce harm to the mother and baby. My mentor for this presentation was Miss Lauren Hancock, APRN. These are my references that I used for my presentation poster. I hope everyone enjoyed. Thank you.